A headache can be a sign of stress or emotional distress, or it can result from a medical disorder, just like the case I'm going to share with you. Bella was a 29-year-old lady presented to the clinical department complaining of throbbing pain over the head. Beside the throbbing pain, she had a complaint of having nausea and photosensitivity. Bella's past medical history revealed that she had no illness or injury before this condition. This type of situation started when she was pregnant. She experienced this kind of headache 10 to 12 times in a month, which remained 8 to 10 hours a day. Her physical examination showed that she had a pain over the left side of the head. Bella's vital signs were taken. Blood pressure 126 by 82 millimeters of mercury, pulse rate 82 per minute, and she was afebrile, having no temperature rise. Her systemic examination was normal. Based on the patient's symptoms, past medical history, and physical examination, the doctors referred the patient to the neurology department, where different imaging tests were performed for making a clear diagnosis. Now, what imaging results do you likely expect in this case? How will you further move forwards towards the right diagnosis? What suitable radiographic techniques will you perform to confirm the diagnosis? Is Bella suffering from migraine, and how will you treat her? It will be easier to answer these questions when you have a thorough understanding of Neurologia Cefalea, sqadia.com, bringing a complete lecture of more than 40 minutes on Neurologia Cefalea, along with short clips for quick learning. You can watch these videos on sqadia.com to solve the case study. Simply go to sqadia.com, subscribe, and get a free trial of 2 days.